Hi, everyone. Thanks for joining our Health Tech Build program today. We're excited to have you here listening to what we know are compelling topics in healthcare and life sciences. Our purpose in bringing together deep insight and experience in our events is to create opportunities for collaboration between sectors and to accelerate digital technology within the healthcare and life sciences domains. I'm Dean Andrews, a board member of Health Tech Build and head of developer relations at InterSystems. At Health Tech Build, we're very proud to have had many leading organizations participate in our events on many topics. If you think you might be interested in partnering with us, we'd love to hear from you. Please reach out to us via our website, healthtechbuild.com. Thank you very much.
Hello, my name is Emily Olson. I am the senior editor at Moby Health News. Thank you so much to Health Tech Build for hosting this talk and MediCuity for sponsoring. I'm here today with Greg Fisher. He is the director of Practice Point out of the Worcester Polytechnic Institute. Thank you so much for being here with us today.
Thank you so much for having me. I really appreciate it.
Yeah, so let's just jump right in. Let's start with Practice Point. Can you tell us a little bit about your work there and kind of what you're doing with your research?
Yeah, absolutely. So first off, I'm a professor in the robotics engineering program at Worcester Polytechnic Institute. In that role, I'm the director of the AIM Lab, the Automation Interventional Medicine Robotics Laboratory. There we do a number of research topics in medical robotics. The majority of our work is related to image-guided surgical interventions. So how can we use medical imaging to guide surgical procedures, including putting robots inside of MRI scanners, for example, to do interventional procedures. So we have work with, for example, the Brigham and Women's Hospital, where we're trying to do high precision biopsies for prostate cancer, putting robots inside MRI scanners and doing very targeted tissue sampling. So that way we can get higher sensitivity and reduced number of cores that you need to take. We're also doing research on neurosurgery, where we're trying to increase the accuracy of thermal ablation, where we're trying to burn brain cancers, again, using live imaging from the MRI scanner, so we can actually get live interventional imaging while we're doing procedures. But what I want to talk a little bit about was Practice Point. So we had funding from the state a few years ago to build out a new facility that can really support economic development in the medical robotics and medical cyber physical systems research areas. So what we have is we've dropped point of practice clinical care scenarios into an engineering setting. So we have a fully functional operating room. We have an MRI scanner. We have a patient suite set up like an ICU, for example, and doctor's office visits. We have a rehabilitation suite with motion capture. We have a mock one-bedroom apartment that we can use for home health environments. And then we also have manufacturing capabilities that are co-located with this. So the whole idea was to have this playground or sandbox where we can be developing these different types of medical devices, be able to test them in realistic environments, both on the development side and then also to bring out key opinion leaders and get feedback, or to do training or to do demonstrations. So we have a lot of companies that are working with us, from the smallest startups to some of the biggest companies in the state in the medical device space, working in this facility, working alongside faculty and students. So we have a lot of really interesting research from faculty at WPI in medical robotics. Then we also have a lot of really interesting work from our corporate partners that we're working really closely with.
Wow, that sounds really interesting. It seems like you have like a whole set of different tools there to work with.
Yeah, for sure. So the whole idea was, we figured out what were some of the challenges that we've had in medical device development, in particular medical robot development, and we really wanted to address this. So, some of the issues I'd had in the past was, we'd have to go into the hospital in the middle of the night for a couple of hours to do a testing in an MRI scanner, for example, and you'd have to pack all of your stuff up. You'd bring it out there. By the time you got there, it might have gotten broken in transportation. You do a quick experiment. You have to pack everything up and get out. And, the MRI scanner might be a little bit more logistically challenging than other areas, but in general, working around the scheduling and access within a hospital is very, very challenging. So for our research in MRI guided robotics, we can, set up camp, if you will, in an MRI scanner for days on end to test out our robotic systems. That's something you really couldn't do anywhere else. The operating room that we have set up is probably about twice the size of a typical operating room. We have all the capabilities you typically would have in there, but we also have motion capture, closed circuit TV, all sorts of interesting networking configurations. So it's very, very flexible setup. We can do testing for all sorts of different devices. So it really is a fun and very fully featured area that we can test pretty much anything that you want to be testing.
Well, that's really cool. So kind of our topic today is like surgical innovations. So what do you think are kind of the biggest innovations that are in that space right now?
So I think one of the most important things is how we can tie in interventional imaging, right? So, historically, a lot of surgical robots or really any type of surgery was done based off of imaging that was done preoperatively. Where I think
Mhm.
there's a tremendous amount of opportunity is how can we use intraoperative medical imaging to guide the procedure as we're performing it and take into account things like tissue deformation or instrument deflection or understanding what's happening to the tissue as we're doing this, or using sensing to look at the tissue and monitor it and try to identify abnormalities or identify tumor boundaries, right? So I think this idea of adapting the surgical workflow during the surgery itself based on additional information we get at the time, I think that's really a tremendous opportunity moving forward.
Wow. So one of the things I kind of wanted to move into was artificial intelligence, because I think that's a really hot topic right now in healthcare and life sciences. How do you see it being used in the surgical space?
Sure. No, it's a very exciting time to be involved with that. That term, I think everybody has a different thing in their mind when we're talking
Hmm.
about artificial intelligence, but actually, I'd say it's a really diverse spectrum of ways that you can use artificial intelligence. On the one hand, it might be trying to automate surgical tasks. So some of the work we're doing in my lab, for example, is how can we do learning from demonstration to understand how a person does, let's say, suturing, or how do they aim an endoscope, for example, so that we can try to streamline the workflow in a surgical procedure. Another side of that could be looking at imaging, so automated diagnosis in radiology to, for example, determine if there is an abnormality, or if there is, can we use AI to improve segmentation and find, for example, tumor boundaries?
Hmm.
So there's a really wide array of ways that we can use AI. I think there's a tremendous opportunity in using it to help guide surgical planning, in particular coming up with like initial guesses of surgical planning, because I still foresee the surgeon being the one that's ultimately responsible, but we can use AI's ways to help kind of come up with this plan or come up with the first guess of this plan that can get approvals, if you will, of the surgeon that's responsible for it. But then also on the surgical side, one of the ways I like to see AI is, how can we take advantage of all of the capabilities that a robot has? So if you look at something like the Da Vinci surgical robot, it has 4 arms on it, typically 3 surgical arms and 1 imaging or camera arm. Obviously, you only have 2 user inputs. So is there a way that we can optimize that without having to have the doctor, clutching essentially between, this arm could be controlling one of these arms and this controlling one of these arms?
Hmm.
So working into ways, can we, for example, automatically identify what task or subtask somebody's working on and then automatically control the endoscope to give them the optimal point of view based on, machine learning algorithms? Or can we find ways to, essentially have the surgeon, let's say they're tying a suture, maybe they can tie the first strand and you can automatically grab it and then pass it back to them. So the surgeon is still controlling and guiding the procedure, but how can we take advantage of all of those arms? Or maybe you can have an automated retraction on, let's say, the third arm on the surgical robot. So I think this idea of using AI to essentially create the automated cooperative control is really an interesting area as well.
Yeah, it kind of sounds like the surgeon is still really in control there, but you have that kind of AI background to kind of complete the task or kind of follow in after. Does that make sense?
Yeah, that's exactly how I foresee it. I think the important part is, there are certain things that the surgeons are really good and there are certain things that robots and automation are really good for. And it's really important to figure out what the optimal way to configure this is. And at this point, the surgeons have a tremendous amount of expertise. They know exactly what we want to be doing. Ultimately, they're responsible for how this procedure goes.
Mhm.
But there are certain tasks that I think are very well suited to the robot, either because they can have the very high precision that you need, or because you need collaboration or coordination between multiple arms, or maybe they're just tasks that don't really require a tremendous amount of expertise. So you could go and say suture along this line, and the robot can go automatically, suture or cut along a line, for example. Or
Mhm.
you can imagine in, let's say, a orthopedic application. You can use them very similar to the way you'd be using it for an implant, right? The robots are very good at cutting out very precise, perfect shapes, right? So you can think of these types of scenarios that there are definitely places where robots have a huge advantage over the surgeons, but then also I think there's a lot of areas where the surgeons are the ones that really ultimately are responsible. So this idea of cooperative robots, where the robot is working alongside the surgeons, is really, really important in figuring out what aspects each one is really responsible for.
Right. So they're kind of like working together. The humans do the stuff that humans are good at. The AI does stuff that AI is good at.
Yeah, absolutely. And this is one of the things that I find really exciting about surgical robots because, in the industrial space, usually you take an industrial robot, you put it in a big safety cage and say, don't let anybody go near it, right? In the surgical robot space, it's very much about how can the surgeon work very closely with both the surgeon, sorry, how can the robot work closely with the surgeon, but also work obviously with the patient and also the rest of the staff that's in the operating room, because usually there's an entire entourage of people that are
Mhm.
in the room. So making these robots work really closely in that environment, I find, very, very interesting.
Yeah, one of the kind of frequently discussed potential dangers in healthcare with AI is this idea of like biased AI that could introduce like health inequities where there kind of weren't where there weren't ones previously or make them worse. Is that the problem with surgical AI, or do you think there's like another issue there that people should be keeping an eye out for?
Yeah, so I think the first thing when you think about AI, just in general, is you need to make sure the data sets that you collect are representative, right? If the data set you collect is not representative of the population, the results you get aren't going to translate well to the rest of the population. So if there are certain diseases or certain problems that certain parts of the population have that others don't, if they're not well represented in the data that's being used to generate the AI models, obviously they're not going to be appropriately usable in those scenarios. But on the other side of the coin, I think AI is also very dependent on the way we perform these surgical procedures, right? So we're trying to, as I mentioned before, try to automate surgical tasks. And one of the things that we've found is, there's not just one right way of doing a surgical task. So if you're trying to do, let's say, a learning from demonstration to automate an aspect of a surgical task, if you watch one surgeon do it versus a different one, they're not necessarily going to follow it the same way. So there's a tremendous amount of diversity in the way that surgeons go about tackling problems or the way they perform procedures. So I find that really interesting, and you need to find ways to take that into account when we're trying to add automation to surgical tasks or trying to learn what the right way, if you will, is to do a certain procedure.
Yeah, and how do you determine that? How do you kind of figure out like what is the right or the best way to do a procedure that we could train this AI on?
Yeah, that's actually a really good point. For example, one of the things we were doing was trying to, automate moving the endoscope, but it's, not necessarily the same viewpoint that every surgeon would want doing a certain task, or the way they perform a suturing task may not be identical. So, originally we were looking into, can we get a bunch of users in, learn a generic approach from them, and then from there try to teach the robot. But I think we're actually coming more on the idea that you really need to train it for an individual surgeon. So it might be not coming up with a general, approach or model for doing a certain task. It might be that this surgeon does it a certain way. So can we learn the way that
Mm.
that surgeon does it? But yeah, these are really important topics to think about. Is what do you want to learn from? Because we also do work in other medical robotics tasks, and we had actually a very similar learning from demonstration to try to teach an exoskeleton to walk. But if I watch a lot of people walk in a motion capture lab, they all walk pretty similarly, and we were able to generalize across lots of people. But if I'm trying to look at the motion a surgeon has when they're suturing, it may be very different actually for different people. So you really need to, even if you're using the same math behind the scenes, you need to think about how we deal with it.
Yeah, and kind of continuing on the AI area, like, do you have any observations or thoughts about how like regulatory agencies should approach approval and validation for AI-enabled tools for surgery?
Well, I think maybe flipping that around a little bit, I think it's just really important if you're making AI algorithms, you need to understand the way the regulatory framework works.
Yeah.
A lot of people that are working in AI, if you're a software developer, it's you want to just really quickly come up with some cool new idea and get it out there. The FDA is going to treat this as a device, and you're going to need to validate that device. So if you come up with some new AI algorithm, you're going to have to essentially create this algorithm, lock it down, do a very thorough validation of this system before you actually deploy it. And if you're collecting new data along the way, the ideal scenario would be every time you do a new case, you learn something new, you make your model better, and you implement, essentially send it out and start using it. But that doesn't work in the medical device space, right? So it's still a good idea to be collecting all this data as we go along and improving our models, but you're not actually going to be able to release it essentially every time you have new data. You're going to have scheduled releases, and each one of those releases is going to have validation that goes along with it. So it's really important to think about how do we understand essentially breaking it up into when do you have something that's worth releasing, and then understanding how can we validate that to make sure that it's appropriate. The other side of that is there's a big push now for trying to have more of an understanding of what AI is doing. If you
Mm.
start thinking about it as a black box, it's really hard to have faith or trust in it. Whereas, if you can say some sort of trust level of how much do you trust it, or or if it can be clear about what scenarios it works in and what scenarios it doesn't work in, or if it's making a decision, if it can give you some indication of what were the factors it had when it made that decision, right? You could think of an automated diagnosis scenario, right? Then you can start to have a lot more trust in it. So I think there's a lot of push for this kind of understandable, if you will, AI to know how it's making those decisions and why, and how much you can trust it and when it actually can make those types of decisions.
Sure. So, kind of shifting gears a little bit, like one of your interests and research interests is robotics. So, how have you seen surgical robotics change over the course of your career? And what do you think is coming next for the field?
Oh, sure. That's actually a really interesting question. So, when I first started back in graduate school, I always kind of thought of surgical robots in like two different classes. There was essentially image guided surgical robots, which were kind of like these, point and click systems you get an MRI or a CAT scan, ultrasound. You click a
Mhm.
point, the robot can go and stick a needle. So that's like a percutaneous task of like taking a biopsy or doing a delivery, and that kind of robot. And then there was a completely separate set of class of robots that were more the teleoperated robots, typically no automation, remote controlled with vision through, let's say, an endoscope type system,
Mhm.
right? What I see now is there's a lot more of a merging of these, of how can we essentially have dexterous robots that are getting real-time useful information at the same time. So how can we actually have robots that during the procedure we're getting live feedback, whether it's from typical medical imaging modality like MRI, CAT scans, ultrasounds, X-rays, anything like that, or maybe it's using fluorescence imaging, or maybe it's using some sort of molecular imaging or tracers that are injected or photoacoustic imaging, right? So I think this idea of using live imaging and then adding intelligence and adding automation to these tasks, I think it's becoming more of kind of merging these together, of having intelligent, dexterous systems for various different procedures.
Yeah. And so since you're interested in robotics, like outside of strictly like surgical robotics, ones that are helping to perform surgery, how else are they kind of used in healthcare to kind of augment workflows or help staff, including surgical staff?
Oh, sure. And actually, in my lab, I have my hand in a lot of different robotic tasks. So I'd say our core funded work, mostly through the NIH, is image guided surgical robots. But we actually do work in exoskeletons. So, for example, wearable exoskeletons to help people that have paralysis walk. We
Mhm.
have upper limb exoskeletons, for example, that can help people do activities of daily living. On the rehabilitation side, I think there's a tremendous opportunity for robotics of how can we help with essentially occupational therapy or physical therapy of patients to essentially relearn the motor mappings when they've had neuromuscular injuries, for
Mhm.
example. So I think on the rehab side of things, there's a tremendous potential for wearable devices. And then there's nursing robots as well. This is an area that's really starting to take hold, is how can we have robotic devices that are helping with all sorts of different tasks around the hospital. Especially with COVID, telehealth and telepresence is really starting to take off. So having telepresence robots, and ultimately, I think there's going to be a lot more, telepresence robots that can actually directly interact with the patients, and whether it's more of a nursing scenario or medical assistant scenario to take, vital signs, or maybe it'll be even more involved moving forward. And then like
Mhm.
one more step removed from the patients is things like lab automation is getting more and more popular, right? So how can we have robots that are helping to automate lab tasks? We have some robotic systems on the biofabrication side to try to make things like artificial vasculature, for example. So there's a few things that are kind of, behind the scenes that no patient would ever actually see, but I think there's a huge swath of areas where robotics can start to make some really, really significant impacts in healthcare.
Yeah, and I think especially when we're thinking post pandemic or as COVID-19, there is a lot of like provider burnout. There's a lot of discussion about nurses not being there not being as many nurses as needed, there aren't many as
Right.
doctors as needed. Is that kind of a focus too, to kind of have these robots augment workflows so you don't need them to do some of that stuff?
I think it can be very helpful to have robots that are, I guess, augmenting the services that are provided to patients. I don't think
Mhm.
we necessarily want to be replacing nurses with robots, but some of the other work that we do, for example, is therapeutic robots for autism and other applications, right? So we actually have a robot, we call it PAVI. It's the Penguin for Autism Behavioral Interventions. And the idea is this robot can actually do ABA therapy with children. I'm not trying to say that the robot can actually do better than a service provider, let's say a therapist or a certified BCBA, for example. But if you have a limited number of people that can perform that test, you can actually get a lot more services to a lot more children, and then you
Mhm.
can essentially have this, additional care, right? There's more of the intervention that can be performed, So I think there's advantages to having robots that are out there, and in some cases, I think the robots can actually make things more personable. And this is a little bit counterintuitive, but we noticed this with this autism robot, that when the robot was actually helping to perform the ABA therapy sessions, the teacher or the therapist was actually able to be much more engaged with the patient, or in that case, the child, because they weren't busy with taking records and keeping track of the notes and doing all of the other things that are kind of annoying and frustrating behind the scenes. And they were able to much more interact with the actual person. right? So I could see this in a nursing scenario where maybe the robot is doing the charting and taking the vitals, and then you have a nurse or the practitioners that are actually being able to have much more personal reactions or relationships with the patients. So I do think there's a tremendous opportunity for robots, and not necessarily replacing nurses and not necessarily making it more, robotic, if you will, but actually I think there's ways to use robots to make it even more personal.
Yeah. So another place that I've kind of seen more companies getting into is using virtual reality for surgical training. Have you heard of that? Do you think that kind of improves the learning experience for kind of up and coming surgeons? And like, why is it better if you think it's better?
Oh, sure. I think there's kind of two sides to that coin. I think the one side of it is using VR, people can get a lot more training and they can work on these tasks for a significant amount more time than they could do in a realistic scenario. So this
Hmm.
idea of being able to have more time actually practicing and playing, if you will, with these systems, I think that has a huge advantage, right? And also it might be possible to start showing scenarios that are so rare that you wouldn't normally see them in a certain hospital, or you wouldn't get a sufficient number of those. So I think there's a tremendous advantage to using VR, and that you can get lots of different scenarios and you can use them as often as you want, kind of like a flight simulator, for example, to train pilots, right? You can train all these disaster scenarios that you would hopefully never see, or if they do happen, they're super rare, right?
Hmm.
The other side of it is, though, that the fidelity of these training is still nowhere near what it would be in a realistic scenario, right? So even though
Yeah.
we have really good looking simulators, they still don't look the same, they still don't feel the same. When you start doing surgery and suddenly there's blood everywhere, right? It just doesn't have that same feel as you would have in a simulator, right? So I think there's a tremendous amount of benefit to being able to do this in real scenarios. So I don't think VR is going to replace actual physical training, but I think it's a great way to supplement it, because it can give you a tremendous amount of practice before you actually get into the realistic scenarios, and then also able to potentially look at certain, disaster type or different types of scenarios that
Yeah.
are rare and might not actually happen that often in a real case.
Yeah, I've also seen VR being used for surgical planning, and you were kind of noting earlier kind of how these technologies can help people plan out in advance. Like, do you think that's another good application for VR?
Yeah, I think that's actually a really great application. In fact, one of the things that we're looking into is, for example, neurosurgery planning. If we're trying to do thermal ablation, right? I'd love to be able to pull up a 3D model of the brain and have the tumor in there, and be able to essentially sketch out the boundaries, look at, for example, the different ablation regions and see how they align. We can look at the sensitive anatomy, right? And make sure we pick trajectories for the needles that don't go through certain areas where you might actually cause damage. So yeah, I think on the surgical planning, there's actually a tremendous advantage to VR, and then also AR, so augmented reality,
Oh,
where
yeah.
we can actually overlay images on the patients. So when you're doing a procedure, are there ways that we can actually look at the patient and see the anatomy on there? And there are companies that have developed those things. We've also had some work actually that I did previously where we were trying to essentially overlay MRI or CAT scan images on the patient, so we could do needle placement procedures, and you can actually see the
Mhm.
internal anatomy where you're inserting these needles. And we had really, really positive feedback from the clinicians for using these. So I think that it really depends on the scenario of what the best way to do it is. I think there are certain cases where robots are by far the best way to do things, and there are other cases where having an augmented reality might actually be the better way to do things, right? So it really depends on what the application. But I do think that there's very much a place both in the surgical planning and then also in the guiding a real intervention to have either virtual reality or augmented reality.
Yeah, can you tell me a little bit more about that AR that you were involved with? It kind of provided an overlay on the actual patient so the surgeons can just kind of see where that anatomy is.
Yeah, and this was really exciting because it actually turned out to be one of the simpler technologies we developed, and also one of the best received technologies that we've
Mm.
developed. And the idea was, we, rather than having virtual reality or augmented reality goggles, we essentially created an optically stable image by creating a monitor and a semi-transparent display, and then we had the patient below that. And what happened is, as you essentially get the image floating on the semi-transparent image, it was a optically stable image. So as you moved your head around, or as there were other people in the field, they also got that same image. And what you could do is you could actually see the anatomy inside the patient. So as you're trying to insert, for example, a needle, and we were using this for things like joint arthrography, where you want to do an injection of contrast agent into the joints. And we also did it for spinal interventions, where you wanted to do essentially like steroid injections into the facets of the spine, for example. It works really, really well for those kinds, because you can actually see the anatomy. You can kind of even feel your way around. So as you're trying to stick the needle into, for example, the joint spaces. So it was very, very effective. And, I think there's definitely good application for that. But I've also seen other groups that are working on, augmented reality goggles. And as you look through it, you can essentially see the medical imaging and or the surgical plan floating inside, the patient. And I think that
Oh,
has a
wow.
really good application as well.
Yeah, you mentioned that yours was like a simpler like application that you found out. Is that something that you see a lot, that sometimes the simplest thing might actually be the best thing for some surgeons?
Yeah, absolutely. And I actually put a slide like that when I teach my biomedical robotics course that, there's an entire spectrum because, in graduate school, I actually did everything from, complex surgical robots to image overlays. In some cases, we actually did laser guides, and we essentially just projected a laser along the line that we wanted. And as long as you
Mhm.
put the needle, so the tip of the needle and the head of the needle were both in that laser, you're on the right trajectory. And then we even had an even simpler one, which was essentially a bubble level on a protractor. And, that actually worked fine for things like, putting needles in the spine in some cases. So you really need to figure out what the right technology is for the particular application. That being said, getting back to one of my earlier points, I think there's a tremendous advantage in a lot of procedures, especially soft tissue type procedures, to take into account tissue deformation and tissue motion. And in those types of scenarios, you really need to have the real-time image updates. And since you have the real-time image updates, you're going to want to have real-time changing of the trajectories, right? So I think in those types of scenarios, having robotic devices that work inside of imaging systems have a tremendous advantage. And you could think of in brain cancer applications, or let's say if you're working in the abdomen, trying to do surgical procedures on, let's say, a liver or a kidney, when you're working on tissue that either deforms on its own, or you have respiratory motion, or you have brain shift, right? Those kinds of things, it's really important to have real-time imaging.
Yeah, so we're getting close to time. So just kind of
Sure.
for like our final question is like, what do you think are some of the problems that still need to be addressed in surgery that you think that tech could kind of help with?
That's actually a good question. So I have to think about that a little bit here. Um, I guess getting back to the point I'd mentioned before is, one is how can we effectively use all the information that we have at the time of surgery, right?
Hmm.
So how can we try to inform the procedures and not use, I like to refer to as stale imaging, right? A lot of times you have preoperative images, but by the time you actually get into the procedure, and certainly by the time you're well into the procedure, things have changed inside of the body, especially if it's, maybe an orthopedic application, things are pretty consistent, but in soft tissue, things change quite a bit. So I think that's a really important area to get into. But in addition to that, yeah, that's a good question. Hmm. I guess some of the areas that are getting into more problems recently would be how do we deal with having all these intelligent systems inside of an operating room, right?
Hmm.
In the past, you asked before, what was one of the differences between robots, let's say 10 years ago versus now, right? 10 years ago, pretty much everything in the operating room, you would disconnect it from the network jacks, right? They were all standalone devices. But now once we're getting to the point that everything is either connected to either intelligent systems or remote controllers, or we want to start having remote AI algorithms that are operating on something. All of these devices are interconnected, right? There's so much more interoperability. So how do we deal with all of these devices communicating with each other? How can we deal with the reliability of them communicating? Cybersecurity is becoming more and more of an issue, and we need to really understand, what are the particular challenges between these devices interacting with each other, and one, making sure that the data we get, the integrity of that data is maintained, right? So you got to make sure whatever you're getting is actually correct. And you also need to make sure that, for example, it's not going to get corrupted or shut down. If you're relying on, let's say, an image stream or an image data stream, and then that gets corrupted, now suddenly, how do you deal with that? You're going to be essentially flying blind, if you will, right? So, yeah, I think, as we get to more and more intelligent systems that need to be more interconnected, more networked, I think there's some really interesting challenges that we're going to need to address. And I imagine there's probably going to be a lot of regulatory aspects that are related to that as well moving forward.
Yeah. Well, again, thank you so much, Greg, for joining us today for this fireside chat. Also, thank you to everyone that tuned in, and be sure to check out more Health Tech Build events at healthtechbuild.com.
Excellent. Thank you
I'm
very
Emily
much.
Olson. Yeah, thank you so much for joining.
All right. That was great, guys.